Jennifer is the CEO of the Searfoss Consulting Group, LLC, since its founding in 2011 and is focused on revenue cycle management and strategic planning in this post-health reform world. Jennifer has had the pleasure of teaching at the University of Maryland, Baltimore County, where she taught healthcare law, international diplomacy, and women in politics, and at George Washington University, teaching healthcare policy. Jennifer has been a member in good standing of the Maryland Bar since 2005.
So the first thing I want to say is that PQRS, as we know it today, has been around for a long time. It actually was established back in 2006. And in 2006, Congress said, you know what, we need to do more to ensure that we're getting our true value out of the Medicare program. And so they came forward with a program called PQRI. This is back in the days of Tom Scully at what he wanted to call, it was MoMA. It was going to be the Medicare and Medicaid Administration. And guess what? There was a lot of women who were offended by that name. So instead, he went with CMS and the program PQRI. Congress then came in, tweaked the program a little bit. There was incentives to report a limited number of quality measures. One of the first measures was doing e-prescribing. The program moved forward and matured. It was then renamed in 2011 to be the PQRS that we have today. But notably, Congress said, you know what, we can't just do incentives anymore. We have to stop this. We have to actually say, we've done enough carrot, now let's try the stick. And so that is what Congress decided to do. The first penalty started last year. Last year was the base year for 2015, meaning that, again, and I'll get to that, but if you were still in your private practices and you didn't report a quality measure during the entire year of 2013, guess what? You would have a penalty in 2015. So what does that tell you about Medicare? It tells you that they've got sort of one thing that's a problem, and it's called data.